This afternoon, we are learning that more Zika cases have been confirmed in a heavily populated part of Florida. David Begnaud joins us now by phone to explain what we've learned. David.
Hi there. I'm actually listening to the CDC conference call right now where the head of the CDC, Dr. Tom Frieden, is giving an update. The cases now stand at 14 in the area of Wynwood, which is north of downtown Miami. It is a thriving art. It's a go-to area. It's become something of the new cultural capital. So this cluster to be found in this area troubling simply because of how popular it is, not only for locals and tourists. What the director of the CDC is saying is that almost all, they've identified 10 new cases that they made public today. And of those cases, about 80% of them all come from that area, where it's believed that within the last 15 to 18 days, 2 cases were first. People worked in the Wynwood area. They tested positive for Zika, and now these new cases that have been identified in the Wynwood area are apparently right in the same spot within less than 3/4 of a mile of where the first 2 cases were detected. Dr. Frieden wasn't alarming on the phone, but he used the word scary in saying that we are worried that this is going to continue and we're going to see more cases. He doesn't think that this is going to turn into a statewide outbreak because as it works with Zika, the mosquitoes that carry Zika travel less than a half mile in their lifetime. So unlike with West Nile, where a bird might get West Nile and fly to the northern part of Florida and infect someone there, the mosquitoes are pretty much located in the area where they are born and die fairly quickly. So this cluster is found in this popular tourist area. We had 4 as of Friday. We now have 14 as of today. The CDC is sending down a crisis response team here to Florida at the request of Florida's governor to work with local officials. We were in a clinic today, Vlad, and we talked to 3 pregnant women, and I got to tell you, 2 of them walked up with sleeveless shirts on. And that's exactly what you don't want as a pregnant woman walking in this zone. This clinic where we were is in the Zika zone, the 1-mile Zika zone. And the women weren't dismissive about it, but they didn't really seem that worried. And the reason they should be worried is because women who are pregnant, who have the Zika virus, oftentimes deliver children who have microcephaly, deformed heads. It is tragic. It is sad for these women. Men can also contract Zika, and the threat with them and the concern there is that they then could give the virus to a woman or someone else through sexual transmission. So that's where it stands as of right now in the area. We have 14 cases today, and the CDC director says he thinks that number is going to go up, possibly day by day.
All right, David Begnaud reporting for us in Florida. David, thank you so much.